I'm Dr. Mike Nenanichesema. I'm the Deputy Director, Preventive Health Services, responsible for immunization. In essence, I'm the National Program Manager for Expanded Program on Immunization under the Ministry of Health. We are the ones that are actually behind all the immunizations that we offer to children, but also with the current COVID-19 pandemic which we just had, we have also expanded our scope to also provide adult immunization. What we have faced in the most recent past, but also where we're coming from, is that a lot of our data is kind of generated but also lost in some way because we have been using hard copies to deal with that. But also the rapid adjustments that we need to make, especially when it comes to new introductions of vaccines. This turns out to be a huge amount of job or task, because we have to make sure that we also change our documentation to at least accommodate the newer interventions that we are doing, including new vaccines. So because of that, it's becoming quite expensive, one, to actually redo all the registers where need be, but also quite an expensive venture when it comes to storage and archiving of such kind of data, because even now our infrastructure is not giving us enough room and space to actually to keep all these records, all these registers, and sometimes even the tally sheets that we can talk about here. So having an opportunity to put all this into an electronic format, I think it provides us an opportunity for instant adjustments, which I think within a short time can always be accommodated, and you can get everything done within a shortest time without necessarily getting more and more costs around getting the same things done. Of course, in the current setup, what we observe is there has been some movement towards making sure that we put our data electronically, not just looking at the aggregate data, but also considering patient or individual data. Meaning, if a child is getting a jab or is vaccinated at some outreach clinic, instead of putting the records into the hard copy document, health passport, there should be even opportunities where we can put in all this data and key in into the into an electronic kind of data set. We've piloted this with support from partners in Inchewu, Birira. We are yet to roll out. However, we have not done much about electronic register, though we piloted, but I think it's now time that we also need to roll it out. We know there could be more opportunities that will come along with it, very important. However, there's still need for some work to be done, because user requirements are also an issue. Skill sets, people need skilled people to actually be utilizing these gadgets, so that at least we can get the benefit and the impact that we are all looking up to. What we know is there are some opportunities, because we've been able to provide some form of electronic gadgets, but also to provide for connectivity in some areas, so that at least some of these things can be facilitated. But we also know that there is nothing like, there isn't at this point there has to be some way of bringing together the partners so that there's no duplication of the efforts. At the same time, it's a once-off procurement, and then maybe we can work towards a particular time and do another procurement. But from how things have been happening, I think each partner has been coming their way, and this is kind of duplicating the efforts, and we seem not to get anywhere. But otherwise, it's an important venture, and now the ministry has also streamlined the issues of digital health through having a digital health division, which will specifically be looking at this, and that I think is also an opportunity for us to actually work and improve as far as electronic registration of our data is concerned. Thank you.
My name is Felix January. I'm working at the Nchewu district as an EPI coordinator. So I'm under Minister of Health at Nchewu Decho. We have some difficulties that we are currently facing as we are using the immunization data tools for reporting. So there are a lot of them. One of the challenges is the connectivity issue. This is about network. You know, sometimes the network goes off while we want to sync data. Another challenge is on data bundles. We need to have data if you want to send your data to the server. So sometimes when you don't have data, data bundles, then the information is not sent to the server. The other challenge is about training. Our health workers need to have the technical know-how on how to use the system. So if you want your health workers to perfectly work, you need to adequately train them so that they should be able to utilize the system. The other thing is that we need to have these tablets. So when people are sharing the tablets, it becomes a challenge, but it needs that every HSA should have a tablet so that it is able to work around with the system. So we still hope something to happen so that we achieve the immunization registry under the DIPC project. One of the things that we want to happen is to incorporate the information from the register to the gadgets, and all information concerning the cold chain should also be included, so that we should be able to know as to how much doses of vaccine an HSA should collect as it goes for an outreach clinic. We also need to have reminder messages. People in the community, the guardians, the HSA, the chiefs should be reminded as to how many children are due for the vaccine before the actual clinic is happening. Another thing that we want to happen from this system is to generate a daily, a weekly or a monthly report, so that we should be able to know how many children we have reached with our services per period. Despite this, there are also some advantages that we are able to see as we utilize the DIPC. One of which is that it is fast when registering the client, so it doesn't take so long for a health worker or an HSA to complete registering the information into the system. And this system is also smart. You know, when you enter the data, you always retrieve it whenever you want it. So the data is never lost, it's always available. Another thing that is that the system guides you on what to do. When you are registering client, maybe you skip some information, but the system is able to remind you that there is some information that you have not already entered. So you don't even skip any step as you register your client. So the main advantage is that you store all information, whether it's the information of the client, vaccine events, all information is well stored, and you can even retrieve it whenever you need it. Maybe after a month, after a year, the information is always available. Thank you very much.
I'm Martha Madaro, Senior HSA from Jinji under Funnel Health Center. I'm here for user requirements workshop. In our work, there are lots of duplications of events and clients. It's also difficult to handle or carry a bundle of registers at community level. There are also lots of missing information, hence hard to do follow-ups of our clients. With the coming of DIPC, this will help us to have zero duplications of events as well as clients. We are also likely to have no issues of missing data, so it will ease the follow-up of our clients. This will also help us to maintain our data elements like timeliness, completeness, consistency when generating our report. There are lots of potential advantages DIPC can utilize on current immunization responsibilities, such as retrieving of information will be easy. HSA will be guided to which antigen or vaccine to be given at a particular child. Generating a report will be easy as well. And DIPC is a follow-up tool on its own because it provides a rate.